Did you know that it's possible to develop type 1 and type 2 diabetes at the same time, the so-called double whammy? Yes, it's possible. Actually, it's very easy because type 1 diabetics are at a higher risk of developing insulin resistance. So if you are currently injecting a lot of insulin, then it's a good idea to have a closer look. And the problem already starts the very day that we begin injecting insulin. Let me explain how. In a normal non-diabetic body, insulin is produced in the pancreas by the beta cells, and insulin concentrations in the pancreas and in the liver are very high as opposed to the insulin concentration in the rest of the body, which is much lower. And these high insulin concentrations in the pancreas are very important because they suppress the production of glucagon by the alpha cells in the pancreas. In diabetics, however, it's the other way around. Insulin levels in the rest of the body are much higher because we inject insulin under the skin, and they are much lower in the pancreas. So glucagon in diabetics is upregulated, so the liver will see a lot of glucagon. At the same time, the liver will also see a much lower insulin concentration, so it will think that you are sort of fasting. So the liver will tend to release a lot of glucose in the bloodstream instead of storing it as glycogen. This will of course make blood glucose management much more difficult. But more importantly, the insulin concentrations in the rest of the body are much higher than they are in a normal non-diabetic person. And this of course promotes insulin resistance, peripheral insulin resistance. Well, is that the end of the story? Sort of, because no matter how well you manage your blood glucose, you will always become a little bit resistant. Because in type 1 diabetics, insulin levels are always slightly higher than normal, assuming of course that you inject the proper amounts of insulin. Sounds strange, right? We are insulin deficient, but as soon as we start injecting insulin, we have too much of it. So what can we do? Well, there is one way that we can try to reduce insulin resistance, and that is by finding ways to reduce overall insulin intake. And I'm of course not suggesting to neglect blood glucose management. You should always keep your blood glucose in check. But by reducing insulin needs, things can improve. And the best way to reduce insulin needs is to cut the carbs. And this is not a plot for a low carb or zero carb diet. This can also be done on a medium carb diet. I can talk from experience because prior to my carnivore diet, I was following a medium carb diet and I used to inject about 40 units of insulin per day. And a normal pancreas in a non-diabetic person produces anywhere between 20 to 40 units of insulin per day usually. So if you are injecting that sort of numbers, and it can be slightly more as well, because injected insulin is slightly less efficient than normal human insulin produced by the pancreas. Well, if you are in that range, then you're fine. But if you are injecting much larger numbers of insulin, it's a good idea to have a closer look at your diabetes management, because you might very well be insulin resistant. Moral of the story: keep your blood glucose in check, no compromises, but also keep track of your insulin needs.